Pick one innovation for me that you think is most promising in managing, again, this problem of health equity and climate injustice.
Well, the fact that we are treating climate change is something that requires us to look at health equity, because there are, as I said, communities who today are suffering the dire consequences of climate change. They can't afford to just turn on the switch to the air conditioner. They can't afford to take that shade break the way some of us could. They can't afford to even stay home to get a paycheck. What we've learned through COVID and what we're going to see more vividly through climate change is that we cannot have a public health system that is a patchwork of good health and bad health. And unfortunately, because the Constitution left the authority for healthcare to the states, we have a patchwork. And COVID was perfect proof of that. There is no way we will deal well with any pandemic in the future, and no way we will be able to weave together the infrastructure that we need to deal with climate change if we don't weave together the 50 states in dealing with healthcare, which means we have to have a universal system of public health.
Mr. Beccera, are you familiar with an Israeli study that had 2.5 million patients and found that the vaccinated group was actually 7 times more likely to get infected with COVID than the people who had gotten COVID naturally?
Senator, I'd have to get back to you on that one. I'm not familiar with that study.
Well, you think you might want to be if you're going to travel the country insulting the millions of Americans, including NBA star Jonathan Isaac, who have had COVID, recovered, look at a study with 2.5 million people and say, well, you know what, it looks like my immunity is as good as a vaccine or not, and in a free country, maybe I ought to be able to make that decision. Instead, you've chosen to travel the country calling people like Jonathan Isaac and others, myself included, flat earthers. We find that very insulting, goes against the science. Are you a doctor or a medical doctor?
I've worked over 30 years on health policy.
You're not a medical doctor. Do you have a science degree? And yet you travel the country calling people flat earthers who have had COVID, looked at studies of millions of people, and made their own personal decision that their immunity they naturally acquired is sufficient. But you presume somehow to tell over 100 million Americans who have survived COVID that we have no right to determine our own medical care. You alone are on high, and you've made these decisions, a lawyer with no scientific background, no medical degree. This is an arrogance coupled with an authoritarianism that is unseemly and un-American. You, sir, are the one ignoring the science. The vast preponderance of scientific studies, dozens and dozens, show robust, long-lasting immunity after COVID infection. Even the CDC does not recommend measles vaccine if you have measles immunity. The same was true for smallpox. But you ignore history and science to shame the flat earthers, as you call them. You should be ashamed of yourself and apologize to the American people for being dishonest about naturally acquired immunity.
Mr. Secretary, did forcing 2-year-olds to wear masks save lives?
Do what now?
Did forcing 2-year-olds to wear masks save lives?
Making sure people wore masks when it was appropriate was essential to make sure that we were able to get out of this pandemic.
Sure, but that wasn't my question. Could you answer the question that I asked?
Which is?
Did forcing 2-year-olds to wear masks save lives?
And who did the forcing?
Well, your department, or the Head Start, which is under your department, had a mask mandate until late last year for 2-year-olds and above, even outdoors. So can you point to any public health benefit of that policy?
Right. We never forced anyone to do anything because we don't have the jurisdiction or authority to do that. What we did was provide guidance on what would be
Mr. Secretary, did Head Start have a mask mandate?
We provide a mask mandate, a requirement for jurisdictions that wish to receive money to provide particular services.
So Head Start did have a mask mandate for kids, yes?
We had a mask mandate for for agencies that wish to get federal dollars.
So that's a yes. So can you point to any benefit,
that's not a yes to
any
your
public
question.
health benefit from that policy, whether it was recommended or enforced or forced, of requiring young children to wear masks?
Did families benefit from the policy of using all protection, all precautions to avoid
No, I'm not asking you to
COVID?
rephrase my
Yes.
question as some abstract question that you'd rather answer. I'm asking that you, as the person who's the Secretary of Health and Human Services, right now, can you point to any evidence that there was a public health benefit to forcing young children to wear masks?
Well, the fact that today we are not losing lives the way we lost them when we first got into this pandemic.
And you think that's
is
because we forced 2-year-olds to wear masks?
That's your interpretation. What I'm saying to you is that using good policies that give us the precautions to keep our families from contracting COVID are helping save lives.
I want to quote to you from an article from NPR in January of 2022. It says, the United States is an outlier in recommending masks from the age of 2 years old. The World Health Organization does not recommend masks for children under age 5, while the European equivalent of the CDC doesn't recommend them for children under age 12. In retrospect, was it a mistake for the United States to defy the international norm on child masking?
The U.S. has been working closely with our international partners, and we have done more than any other country to try to help.
But that's not what I asked you. I asked you, was it a mistake
countries
to defy the international norm on the issue of child masking?
We continue to use all the best practices when it comes to making sure people take the precautions.
Is there a reason you're not answering my question, Mr. Secretary?
I'm answering the question the best I can because you keep phrasing questions that are already geared to get a particular answer.